Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS. Certificate in First Aid Program, CFAID. BNSL 040 Skills in First Aid. Block 1 Practical Manual I. Unit 1 Observation and Assessment of the Scene and the Victim. 1.0 Introduction. In Theory Course, Block 1 Unit 1 on First Aid and Role of First Aid. Provider of this program, you have already learnt about the importance of first aid and the role of first aid provider. You learned that first aid is the immediate treatment given to the victim in an accident or sudden illness before regular medical help is available. Therefore, when you are providing first aid and acting as a first aid provider, you may come across many situations where you need to observe keenly and assess the condition of the victim in the scene which has contributed to the condition that needs first aid. In Block 2, Unit 1 of the theory course on recognizing emergencies, you learnt about how to recognize emergencies and what to do when an emergency occurs, including scene safety. Now, in this practical unit, you will learn the procedure of observing and assessing the emergency situation. So, let's begin. 1.1 Objectives. After completion of this unit, you will be able to demonstrate how to observe and assess the scene, observe the status of victim, and perform assessment of the victim. 1.2 Recognizing and assessing emergency situations. We have already discussed the various indicators which tell that the emergency has arisen in which one needs to act fast in Theory Block 2. Unit 1 on recognizing emergencies. Here, we shall be discussing the procedure for recognizing emergencies. When assessing emergencies, we need to observe and assess the emergency situations. Observation involves focusing keenly and attentively on a particular emergency situation. Observation is the first step to be taken when encountering an emergency situation. In other words, observation stands for the action of closely and attentively watching someone, something. Assessment stands for inspecting, examining or monitoring someone or something for the purpose of finding out what effect a situation had on someone or something. Assessment usually stands for finding out the impact of a situation and what needs to be done in this situation. It is the next step to observation and more in-depth study of a situation. Purposes. The main reason why we need to recognize and assess emergencies instantly is to act immediately to reduce the complications, prevent further damage and preserve life. Articles required. For this you will need case scenarios of various emergencies which can be read from the newspapers, magazines, television, seen in form of movies, telefilms etc., which will give you an insight into what an emergency is and how it occurs. You can also enact case scenarios where the victim is in emergency. You can also enact various emergencies which are in your curriculum. Procedure. Step 1. Look out and be alert for any unusual noises you hear. Skills. Look out for unusual noises and sights like someone screaming, shouting, moaning, crying, large noise like breaking glasses, tires coming to stop or sounds like something is falling. Step 2. Look out for anything you see which makes you realize that emergency is occurring. Skills. Be alert for unusual things you see like stopped vehicle, person suddenly falling, person losing consciousness, fallen utensils, or pot, spilled medicines, poisons, short circuit of electrical wires, flames and so on. Step 3. Be alert for smells that are stronger than usual. Skills. Be alert for any toxic fumes, smell of wood burning, LPG fumes, nauseous smells, smell from septic tanks, sewage tanks or any other smells which are unbearable. Step 4. Look out for unusual appearance or behavior of the people around you. Skills. Be alert for people who become unconscious, who show difficulty to breathe, severe chest pain, difficulty in speaking, are confused, sweat excessively, express that they are in agony, are anxious and feel that something is happening and they are doomed, etc. Be alert for people around you who scream or shout pointing towards presence of emergency or its development. Step 5. Look out for bleeding, wounds, and overall look of the suspected person. Skills. Look out for blood spots, active bleeding, wounds, parts of body cut off, presence of articles embedded in the body, burns, fracture, feeling of heat or cold and so on, which point towards the suspected condition affecting the victim. Many such situations have been discussed in this or the next block of this course. Step 6. After recognizing emergency, look out for the safety of the scene. Skills. Scene safety is first step, and for maintaining it you must observe and make it safe, assess the scene, and then take the next step towards helping the victim only if the scene is safe for you and the victim. The procedure for observation and assessment of scene safety has been discussed in this unit in section 1.3. Step 7. Call for assistance and approach the victim. Skills. Call for help by activating the emergency medical services, emergency helpline, ambulance, police, fire etc. as required, and also involve bystanders in helping you. If the scene is safe, approach the victim. Step 8. Conduct the assessment of the victim and provide first aid. Skills. The observation and assessment of the victim is done and first aid required must be provided. The procedure for observation and assessment of victim has been discussed in this unit in section 1.4. Step 9. Record and report your findings and transport the victim. Thus, in the above steps we learnt how to recognize emergency and the assessment you should do in these situations. You also learned that you must be alert about your surroundings, emergent situation, and also about the complication this emergency situation can bring about. In the next sections, we shall learn how to observe and assess the scene and the victim. So, let's continue. 1.3 Procedure for observation and assessment of the scene. When an emergency has occurred, then the first step is to observe the scene. For scene safety, always remember that the scene safety is the first step in responding to emergencies and then helping the victim. Purposes. The scene needs to be observed and assessed. An accident can happen anywhere. It can be a confined space, road, river, lake, industry, factory, home, workplace, while traveling, and so on. One needs to be vigilant. Observe and then assess the scene so that safety at all times can be maintained. The assessment of the scene is essential to safeguard yourself and the victim and others in the emergency situation. Articles required. For this you will need case scenarios of various emergencies. You can enact case scenarios where the victim is in emergency and scene is unsafe, e.g. confined space, fires, radiations etc. You can also enact various emergencies which are in your curriculum. Procedure. Step 1. Ask the volunteer to act as victim. Ask him, her to lie down. Skills. Be alert for emergency indicators and signals. Check the area. Step 2. Look out for the situation. Find out what has occurred and what has caused the emergency. Step 3. Look out for surroundings and the placement of the victim. Inspect the area. Skills. See for your safety in the environment where the emergency has occurred. Use safety measures in order to reach the victim. Do not put yourself in danger in any situation. Step 4. Look out for your safety. Carefully inspect. Skills. See for the surroundings like deep waters, fire, depth, height, and so on. Check to see if the victim is approachable or not. Take risks which are worth taking, otherwise you and the victim can both become victims. Step 5. Proceed when you are sure that the situation is not dangerous or before the situation becomes dangerous. Step 6. Remove any hazardous articles present in the environment. Skills. See for cylinders, petrol, diesel, snakes, insects, running traffic. If these cannot be removed, remove the victim from the environment. Step 7. Look out for number of victims. Skills. See for the number of affected persons so that you can carefully judge the level of help required and who requires the priority care as per triage discussed in Theory Block 2, Unit 1. Step 8. Look out for extent of injury. Skills. See the number of injuries the victim is having, amount of blood loss, areas affected, and provide first aid likewise. Step 9. Assess the victim. Skills. After removing the victim, assess the victim. Conduct. Primary and secondary assessment. This is discussed in upcoming Section 1.4. Step 10. Call for help and provide first aid. Skills. Call for ambulance or emergency medical services. Give first aid. If the scene is not safe, move the victim and take him to a safe place and then provide first aid. If the scene is safe, first give the First aid. Use first aid box as discussed in Unit 5 of this block, and then move the victim, discussed in Unit 4 of this block. Take help of bystanders. Step 11. Record and report. You can record your findings as per the recording form given in Fig. 1.1 in the next section. Step 12. Transport the victim. Thus, by following above steps, the scene can be observed and assessed. Scene safety is important and must be maintained. The detailed discussion on scene safety is also given in Theory Block 2, Unit 1 on recognizing emergencies. Now, let's proceed to observation and assessment of the victim. 1.4 Procedure for observation and assessment of the victim. You already know that no accident or emergency situation is identical or same. Every accident or emergency has a different impact and consequence on each and every victim. Therefore, you have to make sure that you observe and assess the condition of the victim. Purposes. Observation and assessment of a victim is done for 1. Examining the overall well-being of the victim, find out what has happened, what injury, wound has occurred. 2. Inspecting for head-to-toe examination of the victim to find out where the injury, wound has occurred. 3. Monitoring the victim for his vital signs, response, airway and breathing, and be ready for emergency care. 4. View the victim and recognize the changes in his, her well-being in the emergency situation. And 5. Watch out for any changes or complications. Articles required. When you have to learn about how to observe and assess the victim, you will need case scenarios of various emergencies. You can enact case scenarios where the victim is in emergency. You can also enact various emergencies which are in your curriculum. Procedure. Step 1. Ask the volunteer to act as victim. Ask him, her to lie down. Step 2. Look out for the situation. Check the scene safety. Skills. The steps for assessing scene safety and maintaining it have been described in section 1.3 of this unit and in Theory Block 2. Unit 1. Step 3. When the scene is safe, approach the victim. Step 4. Tap the person on one of his shoulders and speak loudly, "Hello. Are you okay?" This will help to know the level of consciousness. Skills. Tapping on the shoulder and speaking, "Hello, are you okay?" should be done simultaneously. This is done to check response. If the victim is an infant, age 0 to 1 year, you should tap on any of the heels of his, her foot. Step 5. If the victim does not respond, check for pulse and breathing. Skills. The breathing should be checked by observing the chest rise with each effort of breathing in. Gasping should be considered as absence of breathing. Check pulse at pulse sites. This is discussed in Unit 2 of this block. Step 6. If the person does not respond but is breathing, place him, her in recovery position. Skills. Recovery position has been discussed in Unit 7 of this block. Step 7. If a victim is not responding, has no pulse and not breathing, CPR should be started immediately. If the person shows signs of cardiac arrest, use aid and call for an ambulance. Skills. CPR has been discussed in Unit 7 of this block and aid has been discussed in Unit 8 of this block. Continue till the person is revived or help arrives. Step 8. If the person is responding, check for injuries, bleeding, deformities, swelling, tenderness and open wounds. Skills. Check this as per DOTS format discussed in Unit 1 Block 2 of Theory course. Step 9. After this, proceed to secondary assessment, check his vital signs. Skills. Checking vital signs, temperature, pulse and respiration has been discussed in Unit 2 of this block. Step 10. Talk to the person. Take his history. Skills. History collection is about victim's illness, what he feels, things happened, how injury occurred, his allergies, any medicine he is taking etc. Note any specific things or changes. Step 11. Ask him how he, she feels. Ask for any complaints. Notice any sign and symptoms. Skills. Assess the sign and symptoms. See for pain, anxiety, thirst, dizziness, wounds, burn, vomiting, loss of normal movement, dampness, bleeding, abnormal body temperature, swelling, deformity, fracture, noisy breathing, groaning, chest injuries. This has been discussed in Unit 1 of Block 2 of Theory course. Step 12. Perform head-to-toe examination of the victim. Skills, head-to-toe examination is given in detail in Unit 1 of Block 2 of Theory course. Step 13 Record and Report. You can record your findings as per the recording form given in Fig. 1.1. Step 14 Transport the victim. The assessment of emergency situation can be explained with the help of flow diagram as follows. Look at the screen. Thus, by following above steps the victim can be observed and assessed. This has also been discussed in Theory Block 2, Unit 1 on Recognizing Emergencies. 1.5 Safety and Precautions. Many of the safety and precautions have been discussed separately in the Theory Block 2, Unit 1 on Recognizing Emergencies. In addition to these, we must follow the following safety precautions as given below. 1. When a first aid provider is called to deal with the victim, she must always remember to safeguard him, her and other bystanders and then assess the situation. 2. Make haste without getting panicky in the emergency situation. 3. Observe carefully, think clearly and act quickly with calm and composure during an emergency. 4. Check the scene, find if it is safe for you, for the victim and for onlookers. 5. Remove the dangers to make the scene safe. 6. Move the patient to a safe area if it is not safe. 7. Assess the nature of injury or illness, wound, bleeding etc. 8. Set priorities for the care required and prioritize as per the type of injuries to victims if more than one victim is there. Triage. 9. Ask the onlookers to dial for help and call the ambulance. 10. Try to know the history of the problem, time of happening, any other health problems. 11. Avoid unnecessary handling of the victim. 12. Keep a record of the care provided. 13. Use safe practices in every situation. This has been discussed in Theory Block 1, Unit 3 and Unit 9 of this block. Thus, by applying the above-mentioned safety precautions as a first aid provider, you will be able to maintain your own, scene and victim's safety in emergency situations. 1.6 Let us sum up. In this practical we have discussed about recognizing emergencies, observation, and assessment of the scene and the victim in detail. The observation and assessment is common step which must be completed prior to giving the first aid in any situation. Hope you would practice this procedure and utilize the acquired skills whenever and wherever you encounter the emergency situation. In the next unit, we will learn about the procedure to assess vital signs. So, let's continue. Thank you for watching. We will see you in the next video with the next chapter.